I will turn it over to Corinne Suzuka from CareResource Hawaii.
Thank you, Debbie, and thank you everyone for attending this presentation. I hope this helps clarify these two types of services that are available to you and your family. I don't have where I'm from. I'm Corinne Suzuka. I'm the Administrator of CareResource Hawaii, but this is not just for CareResource. This is for you so that you can understand the two different types of services that we provide in the home and the many other agencies provide in the home. So let's go forward. What are we talking about today? So today's discussion will hopefully answer the following questions. What is the difference between Medicare certified home health and home care? And also after that, we'll go on and ask, hopefully answer the question, how do I get Medicare certified home health services? And how do I get home care services? So hold on for a second. I'm trying to move something away, hold on. Okay, I just want to be sure that you understand these things, and we'll have questions later, just in case I wasn't clear, and in case you have other questions. So let's move forward. So I want to ask first, why do people want to stay at home? My father, that first statement is my father. He said, I'm not living anywhere else. Of course, I had the gall to ask him if he wanted to live with me, and that's what he said. He didn't want to live anywhere else. I live in Mililani, and he lives in town. He lives in a walk-up 2-story apartment, and he's lived there for at that point, 60 years. So he did not want to live anywhere else. And absolutely, I do not want to force him to live anywhere else. I want him to be happy. I want him to have his own choice. I want him to be comfortable where he's at. I want him to feel safe. He felt safe because he knew where everything was in his home. Other family members and friends, he had neighbors who would look in on him, which I was so grateful for. And of course, there are so many memories in your home. Of course, his home did not look like this picture, but it was such a pretty picture, I put it up. So that was not what his apartment looked like. He actually slept on the floor, and that's where he wanted to sleep. Even if I offered to pay for a bed, he didn't want to do that. He slept on the floor for many years. So a lot of memories in your home. Of course, you want to stay at home. That's where you feel safe. And he really did not want to feel dependent on anyone. He wanted to be as independent as possible. And he did feel this was the best place for him to be. So that's where he stayed for 91 years. Well, less than that, minus 30. And let's go on now to talk about the differences between home care and Medicare certified home health. Now, this could be a little confusing, so I'll go through, and at the ending, I'll point out to all of you what the two main things are so you can understand what the differences are. Okay, so what kind of care does each one provide? So for home care, basically is to assist you in maintaining safe care in the home. Usually it's for long periods of time, for chronic conditions. Some of the people that can come to your home are aides, nurses, or companion or chore worker. And usually this type of service is anywhere from 3 hours to 24/7 that you could have in your home. It could be just a respite. Maybe you only want it for 1 week, once a year or every year, because you want to go away and you want your loved one to be safe at the home, so you have someone available. So that's for home care. So for Medicare certified home health, there are regulations that go along with it. Because Medicare does pay for this type of service, they have set up some guidelines so that we can we have to follow them as a home health agency, and the physician has to follow them. So a patient needs to be homebound. That does not mean that you have to be stuck in your bed. It does mean that it takes a great effort for you to leave your home. So you would need a walker or physical assistance or something. So that would be homebound. You also need a skill of a nurse, a physical therapist, or a speech language pathologist, or speech therapist, as they call them, in order for you to have this Medicare certified home health. So the skills of a physical therapist, I used to always forget what a physical therapist is. Many of you may know that, But in the beginning, when I first went into home health, like 30 something years ago, a physical therapist actually deals with big body movement. So any big muscle, walking, um, having balance, being able to sit up. So those are the big motions that, if you need some help with that, that's one of the things that Medicare certified home health could cover. Speech language pathologist not only deals with your speech and your language, but also with swallowing things. So if there's a problem with that, then that's something the speech language pathologist could do. So the skills and the plan of care that's needed for Medicare certified home health has to be directed by a physician. Okay, so everything that belongs in this area has to be directed by a physician. So other services that could be added once the speech or nurse or physical therapist goes out, then there could be need for a social worker or an aide to help with bathing, a home health aide. This service is part-time and intermittent, so usually it's not for long periods of time, but it could be for several months. In some cases, it could be just 30 days. So it just depends on what's needed and what the doctor orders. But it is not 24/7 care. So we do not usually go at night, or unless there's an emergency, we have to go in and check on you. Then it would just be a visit. We don't stay with the person. No meals are delivered. There is no personal care for long periods of time by themselves. But the frequency and duration of these visits depends on how much care and teaching and training and assessment that you need. So that's what the doctor guides the home health agency on how often to go and what they want done for the patient. So that's on the Medicare certified home health side. And let's take a look at more differences. So referral. So on the home care side, anyone can call a home care agency, and to help your family member, to help yourself. So it could be a patient referral or family referral. It could be at times that a Quest service or Medicaid service coordinator could assist with that because of payment. I'll talk about payment a little later too. A discharge plan at the hospital may provide you with suggestions of places that you could call to get the home care. Because there's a payment piece that usually done privately, they do not help you with the discharge plan doesn't really help you with the home care, but they do give you assistance by giving you phone numbers to call. A physician referral is sometimes necessary if there are nursing visits. In some cases, home care agencies do take care of 8 hours of nursing care is needed, or sometimes 16 hours a day. It just depends on kind of case. And usually those are paid for by Quest and Medicaid. So long shift work is done usually if you have Quest. On the Medicare certified side, like I said, physician order is required. So a physician's office, a discharge planner, at the skilled nursing facility or the hospital or the rehab hospital can refer to home health upon discharge from the facility. So if you go to let's start with the physician's office. If you go to the doctor's office, say, looking at you, talks up to you and say, I think you need some home health. They will go ahead and call a home health agency, and a home health agency will call you. When the discharge plan at a hospital or a facility says you need home health, they will initiate the order, and the home health agency will receive that order. But we will need to call your community physician or your primary care physician in order to get further orders, because we need someone to keep on following the plan of care, to keep on giving us orders as we start to care for you in your home. So little differences there. And of course, payment, which is fairly important, so you know what you can do. For home care, it can be private pay, and it can be done by a family member or a client or a trust. If there is no money and maybe you have Medicaid, the Medicaid waiver is called Quest, then authorization is needed from the case manager or service coordinator so that you can have care through Quest. Sometimes also long-term care insurance covers home care, so that It depends though. You would have to read your insurance carefully because sometimes they will pay directly to the home care agency or sometimes they will pay you. So therefore you would have to pay the agency and then the long-term care insurance will pay you. So you need to read that carefully. A lot of you may have long-term care insurance, so that's really a great thing to have. On the Medicare certified home health, of course, it seems quite obvious that Medicare does pay for the service. As long as the regulations and the rules are followed, Medicare will pay for that. But not only Medicare, of course, Quest could pay for it too. So if the only insurance because you're too young and you don't have Medicare, but if you have Quest or Medicaid, then authorization is also needed, but Medicaid would be able to cover the Medicare certified home health or private insurance. So if you're working, but you're going to have surgery and you have HMSA, so HMSA would cover home health also. You have to be careful and double check. And also the home health agency will tell you if there's a copay, but a lot of times there isn't, but it just depends on your insurance. For Medicare, there is no copay. For the Quest, there is no copay unless there's a payment for just the Medicaid part for just having the insurance. So those are the differences. One is a lot more private pay. The other side is Medicare and insurance covered. Okay. And then we have what kind of service are provided. So I actually said some things along the way in the earlier slides. So for home care, we have home helpers or chore workers. And home helpers and chore workers are people who don't touch the patient or the person. They deal with cleaning an area, making a meal, doing light housekeeping so that we can keep the patient safe at home. Sometimes that's all they need because maybe they can kind of go around and take care of themselves and feed themselves, but maybe a home helper is needed to help prepare the meal, or someone needs to clean around the area. Because sometimes, if I miss the trash can and maybe someone can help clean up that area and take care of that, or fix your bed or wash your clothes or those kind of things might be more strenuous for the person. So that's what a home helper or chore worker would do. So the home health aide or nurses aides are people who actually do personal care. So personal care like bathing, like exercising. They could also feed you, and they actually could do some home helper and chore worker services. It just depends if you need hands-on care. So even if you have to get up in bed and you need assistance, if you need help when you're walking to the bathroom, that's what the home health aide would be there for. The licensed practical nurse and the registered nurses are, of course, a higher level. Usually, as I said earlier, usually it's not a private pay issue, but usually is necessary for long-term services under Quest. Or I'm not sure about long-term care insurance, if they'll pay for the nurses piece or not. But of course, you can always check your insurance to see what's covered. So. In some special cases, some agencies have special things like a phlebotomist. So that's a person who draws blood from your arm. That would then be private pay. Or some people have like case managers can follow you and help you not only with the people who are going in, but helping you look at other things that your family or the patient needs. I know of one company who actually, one of their service was so great that they do emergency preparedness. So they prepare you, they come to your home, and they look at the things you have, they see where you need to go in case there's a hurricane or flooding in your area, that they tell you where to go for shelter. They can actually prepare and get the items for you that you need, like extra food, extra clothing, make sure your medications are available for emergencies. So different home care agencies might have specialty things like that. So, but it's good to find out. You can go on the website for them, or you can, of course, call them and ask them what else, what kind of services do they offer. Those are just basic services for home care. On the Medicare certified home health, most of the agencies have these people. So they have registered nurses, and it could have LPNs also, or physical therapists, speech therapists, occupational therapists, Occupational therapists are the ones who do the small movement things. So they help to unbutton your clothes, teach you how to do that, or zip your zipper. They teach you about bathing safely in your bathtub or your shower. So that's what the occupational therapists, social workers, of course, are the ones who assist you if you need further resources out in the community. So, and the home health aides are like the home health aides on the home care side, and they provide bathing services to you basically. Now, the home health and social workers cannot stay in if the nurse or physical or therapists are not in also. So they cannot be sole people who stay in. Whereas in home care, if you only need a home health aide, you can only have a home health aide. You don't need anybody else. In Medicare certified, you need to have one of the other services above the 4 things: registered nurse, physical therapist, speech therapist, occupational therapist, in order to have social worker or home health aide also come to the home. So let's see. So examples of home care. So let's go on the home care side. For instance, I want to give a personal thing is that we did use home care for my auntie when she was on hospice. So as you can see, you can have hospice and you can have home care at the same time. So my husband's auntie was on hospice and was getting great care, but she was getting weaker and she needed more care at the times when the nurse didn't come to visit. So she needed help with her food preparing. She needed help to make sure she was comfortable. She needed help to walk to the bathroom because she was getting weaker. So we called several different agencies actually to have this kind of service for her, provided for her. And sometimes home care can be for if the family, so if you need to work and you don't want the patient to be alone, or your mom or your dad, you may want to have maybe work 3 times a week. And so you want someone there 3 times a week for say 9 hours, covers the time that you're leaving before you go to work, covers the time when you come back home, and gives you some time to travel. So that's kind of what home care could do. They could be there for longer periods of time. On the Medicare certified side, say after hospitalization, someone has a stroke, they may go to a nursing home first, or they may go to a rehab hospital. But even when they come home, they still might need some assistance from physical therapy, like I said, for ambulation or occupational therapy. So they still may need assistance, and we will get a referral and from the physician in the community, your primary care physician, so that services can be offered in the home. Sometimes what they learn helps them, but when they go to the home, it's a little different situation. They don't have air conditioning, you don't have all the things you need like you do in the hospital or the facility setting. And so having someone come to the home for Medicare certified home health will help you get acclimated to your home, and hopefully to improve further your ability to walk and take care of yourself safely. At times too, the other piece that Medicare certified home health does is a nurse may go in to help with wound care needs. So maybe you need dressing changes 3 times a week. The nurse will go in to not only do the dressing change, but also to assess everything else. And they may say like it's 2 times a week, 3 times a week, whatever is needed. Once in a while, home health can go daily, but usually we do like a different kind of skill so that we can be sure that we go maybe 3 times versus daily, but it's actually possible to go daily, even on weekends. It just depends what kind of care you need. And also depends if we have physician's orders. So I have more examples. So on this one, we talk about for home care side, a nurse could go in, and we have people doing that can do medication management. So they will maybe for the patient just needs help with their medications. Maybe a family member drops off the medications, but now the nurse will go there once a week or 2 times a month or once a month, sometimes even, to fill in a pill box so that the patient can be sure that they take their pills correctly on the same day. Or sometimes it's twice a day or 3 times a day, so they'll fill the pill boxes accordingly. So home care can do that, and that's where the nurse comes in. They can do that. Let's see. Oh, so I had other common services. I talked about some of that already for the home care side about bathing and personal care, respite care, and the special programs. So on the Medicare certified side, next another example is, um, excuse me, allowing for infrequent outings. So you know how I said you have to be homebound? That doesn't mean you're stuck in the home and cannot go out. Although a lot of times, a lot of us were stuck in our home during COVID and we were afraid to go out because we didn't know what was out there. But this is different. So say you can always, even if you're homebound, it takes a lot of energy for you to get to the doctor's office. You, of course, can go to a doctor's office appointment. Maybe you need an x-ray just to double check on something. You can go off for x-ray. You still can qualify for Medicare certified home health. You may have dialysis that you have to go 3 times a week. That's allowed. And even Medicare is along the way, after many years of trying to fight for this, we were able to get to tell them that, yes, you can go out to church, because that's really necessary, right? For you to get some spiritual and relationship kind of service, so that we can't provide, but you know, you can go to your church and you can see other people. And that's part of being Medicare certified home health, that the patient can do this. Sometimes too, if you have a special wedding or maybe a funeral, or even to get your hair cut. So as long as it's not like you're out the entire day, that you're out only for short periods of time and you come back home. A lot of times these outings does make the patient quite tired. So that's why they still qualify for Medicare certified home health, that they cannot get these services outside of the home, but they have to have it in the home because it's too exhausting for them to actually leave the home to get these services. So let's see. These are the other services in the last block: from wound management, medication management. So in Medicare certified home health, we don't fill the box weekly kind of a thing. We do teach someone how to manage the medication, whether it's filling a pill box. We can often fill a pill box once a week for a couple of weeks, just as we were teaching someone how to do this, because it does take some effort to be able to do that, especially if you have a lot of medications to put in. There's a lot of training, a lot of education from both the nurse and the therapist for the patient. And those are the differences. We want to be sure. The reason you have home health or home care, though, is because we want you to be safe in your home. We want the patient to be safe in your home. So do you have the basics? It does sound silly, but sometimes it's really difficult to get these things. And that's why at times home may not be the safest place for them. Maybe someone else's home might be safer, but do they have the basics? Do they have the food? Can they get medications? Are they secure? Is it a safe place for them to be? On food and medications, especially during COVID, because COVID has happened, one good thing that has come about is that you can have a lot more things delivered to your home. So you can order things online for food or toilet paper, even those kind of things. So a lot of things can be done so that you can have the basic things at home. Of course, plumbing and water is also very important. So those are all the things you would need. Can you do all your activities to keep you healthy? Can you bathe? Can you dress and undress? Can you prepare food? Now, all those things, the first 3 things, actually, home care and Medicare certified home health might be able to help with that. So if you aren't able to do some of those things, maybe home care or home health could assist you. But can you call for help? Because home care and home health are usually not there 24/7. If you fall or if you don't feel well, can you call for help? So you want to make sure that if you are staying in your home, which is a great place to be, can you go call for help? Whether it's a cell phone or if you have one of those life buttons that you can push so someone can come and help you if you're distressed. Or I guess I'm not really sure how to use it, but I guess Siri and things could also help. So there's a lot more technology available that if you have those in your home, you just want to make sure that you're safe all around in your home. And now we're going to go directly just into the Medicare certified home health. How do I get a referral? So if I know I might need this, how do I know? The best thing to do is first go to see your doctor. Call your primary care physician. If you cannot see them because you're so sick, you might want to talk to them. If you're already in the hospital, you're going to be leaving the hospital discharged, talk to the discharge planner or the case manager so that they can help get you an appointment or to start the referral for you. But your primary care physician would understand. So even if I've talked about the difference between home care and home health, but even if you forget it, if you go to your primary care physician, they should be able to help you and decide which one sounds more appropriate. For the home health side, they could make a referral. For the home care side, you would need to do some calling, but they would be able to tell you, hopefully, that if they think you qualify for the home health side. And if you don't, they'll give us a referral and we'll call you and we'll talk with you about it. So don't worry about all those things, about remembering everything that's there, but there's help that you can get from your doctor or the home health agency or the home care agency if you make a phone call. So of course, like I said, you have to have an order. Once you get the order, the home health agency will call you. But what I'd like for you to prepare is to know your schedule. So sometimes it's hard because you might not know if you have another doctor's appointment to go in 3 days. And that's when the home health agency, they could come. They could always change. So just as long as you know what your appointments and where you need to go, that would be helpful for yourself. So we can get a good date, set up a date for you to get care as soon as possible. And preparing for the first visit in your home. So for the Medicare certified home health, you don't have to have all these things. It's just suggestions. So once an appointment is made and prior to the first visit, if you could have available your health insurance card, if it's Medicare, that's fine. If you have a medication list, or just bring out all your medications so we can take a look at it. Whether the nurse or the physical therapist or the speech therapist goes to your first visit, they will need to have all these things. Look at all the medications you have. We want to be sure that the doctor knows what the medications are, because they may know almost all of them, maybe not some of the vitamins or supplements that they're taking. Sometimes things interact with each other, and so the doctor and the nurse or the therapist needs to know, so we can take a look at all of that. Have a calendar or a notepad or pen. Some of it is to write down your questions before they come. Some of it is to write down the answers. A calendar so you know when they're coming back. Or who else is coming. So maybe the doctor has ordered a nurse, a physical therapist, an occupational therapist, and an aide. So that's 4 people coming into your home. It'll be quite a busy home for a while. And so you would want to have a calendar available so that you'll be able to note down when people are coming. Also, if you have these, an advance directive or a post, and I have to read because I always forget what the initials stand for. And I know Debbie knows them. A physician order for life-sustaining treatment is a post. It's basically a doctor note that says, it's a set thing for Hawaii that tells us what we need to do and what your wishes are. So it's always the case whenever any of these services go, we want to know what your wishes are. Okay, and we want to be able to meet your needs. So we need to know what they are though before we can meet them. So if you could have those things, that would be great. The first visit is long. So rest up the night before, because the visit could take 60 to 90 minutes. Because they're Medicare certified home health, there are lots of things that Medicare has given the home health agencies that they need to do. Certain types of assessment, certain types of paperwork that needs to be signed. And so there's a lot of things they need to do. And during the course of the visit, they may walk you around to your bathroom or walk you to the kitchen because they want to see how you actually do things. Usually we don't want to just ask, oh, how do you do this? Who does this for you? We want to actually see you in action a little bit. You don't have to go through the whole bathing process at all. We just want to see what you can do. So ask you, can you raise your hand or something? Let's walk around. They want to see how you walk, because sometimes I think I'm walking straight and sitting straight, and someone else tells me I'm crooked. So it's hard to tell. You don't really see yourself, but when someone sees you, they can tell better what your needs are if they can see you in action. The subsequent visits for the Medicare certified home health will be only like between 30 and 60 minutes. It just depends. At first, the visits may be 60, and then as things get better and you get stronger, it might be only like 30 minutes of education or training. Okay, and of course, the next thing we'll go into, how to receive home care services. And this one is a little more colorful. Now, so say you're thinking, I need someone to help in the home, but if you can answer some of these questions, that might be helpful so that when you talk to the person on the phone, you'll have some answers in your head. If you forget the questions, don't worry about it. Any home care agent will start to ask you questions that you need. So, and you're thinking, what do I need help with? You do not have to remember, I need a nurse, I need a home health aide, I need a chore worker. You don't have to remember those things. People have different names for things. Tell them what physical things you need. For instance, I need help with my bath. If someone could help me clean up the area a little bit or wash my clothes, could I have help with this? So if you describe to them what you need, the agency can tell what kind of person needs to be in there to keep you safe and to help you with your needs. You might want to think about how many days a week you might need this, how many hours. Of course, all of those things might be determined by the fact is, how am I going to pay for this? A lot of the care I said is private pay out of pocket. It could be long-term care insurance, or like I said, if you have Quest, that might be a possibility that they would be able to pay for someone to come in to do those things for you. There is the option of whether you hire an agency or whether you private hire. I'll talk about that on the next screen. And also, if this is for service is for your mother, on the first visit, you may want to be there with them because there's paperwork to be signed. And maybe you want to have a little more input into what your mother or father or the other person says. It's really up to you. Also, there is a list, and I'll get the site for you a little later. Review the list of agencies and call more than one. So when you call these agencies, oftentimes they have a lot of people who are call-ins, and what they'll do is when you request all these things, they will say, okay, we'll call you right back and see what we can do. So they'll check and see in Manoa, do I have someone who can go there 3 times a week for 8 hours a day? Or maybe they'll have to say in Waianae, I have these things. Do I have someone there? So if you call several agencies, say 3 agencies, at least someone will call you back, and one of them may call you back sooner. You may take the first one, or maybe you have a preference and you might want to go wait for the other one. That's okay. But if you call several, then at least that there are a couple of people working at it. And most of the agencies go in most of areas on Oahu. There are 64 licensed home care agencies on Oahu. And we will have the link for you to get that, as well as a list. Let's see. So let's talk about that pink block I saw in the previous message. And that was the difference between private hire and agency hire. And I read this book. As you see on the bottom, it says, the book is called Aging with Care by Amanda Lambert and Leslie Eckford. So it was very interesting. These are 2 friends who had different opinions on what they wanted. One liked to have an agency to hire, one liked to private hire. So I listed some things that they had. They had longer lists than this, if you want to read the book. So private hire is less expensive because you don't pay for all the overhead costs and those kind of things that are that the agency would have. You would have more control of who is hired, but you would have to actually call people up or find people, put an ad in the paper. You would have to interview the person. But there's a potential that you could have better rapport because you are choosing solely who you want to be in your home. And maybe you have someone who, a friend who knows someone. And so you might want to use that. But please be careful about this part. Sometimes I know that people just hire somebody, but you need to be careful to make sure that you have the payroll done correctly, that there's a background check. Because although people might be very personable when you first interview them, you don't really know if they have other issues. So this person actually does have another agency they hired to do background checks and a pre-employment screening so that they know what they're really getting into. Because this person is going to your home and you want to make sure that it's safe for you or safe for your loved one. On the agency hire, the agency finds the caregiver. When mistakes happens and maybe that's not quite the right fit, the agency will adjust and send someone else out. Now, of course, there's not an endless supply of people, but at least that they can, if someone doesn't come, we can go ahead and get someone else. replacement caregivers are the responsibility of the agency, not solely on yourself. And your time is precious. So we do, all the agencies do a background check. We do fingerprinting, or they do check and they do train them. There's training and there's other policies and procedures that are done so that people are doing the right thing in the home. And supervisory visits are done on the person, not only for you to be sure you're okay, but also on the caregiver who goes in themselves. Especially if they have them there for a long period of time, like a year or something, several times a year, there will be a supervisor. And if you want the supervisor to come out, you just call them and someone would be out. And if you want to change the person, you have to just give the agency a call and a change can be done. So let's go on. Now this one is a little small. Maybe you can see it. So it's hard. What to expect at the first visit with an agency? So the first visit is usually an intake visit. So we do a little, you might call the agency and they call you back and say, yes, we can come on these days. I need to have the nurse or another person go out just to sign papers and make a little assessment. So depending on the agency, it could be a nurse, it may not be. It is kind of information gathering for both you and the agency. The agency needs to find out what you want, and say you ask for, as I said earlier, you ask for someone to do certain things, but when they come in, they see that the patient they're going to be taking care of really cannot walk by themselves. And so a chore person is not appropriate to have it, because all they do, they don't actually touch the patient. So whereas a home health aide would be able to help them get out of the chair, help them to walk. So the agency may decide, we cannot have just a chore worker, we need to have an aide to come in. So that's the assessment. We want to just be sure that the patient as well as the caregiver who comes in is safe. And of course, like both home health and home care, there's always signatures. Whether the signature is because it's okay for us to bill long-term care insurance, it's okay for us to bill Medicare, or whatever it is for home care, if it's okay that, yes, I will pay you. So there are signatures that need to be had at that visit. And that visit, usually the caregiver isn't there. Sometimes they might come after, sometimes they might come another day, but that is the initial visit. Usually they want to be sure that everything is good and that you both understand what the needs are. So it sounds like a lot of work to get home care. So therefore, I want to be sure, we all want to be sure that you get what you need, but maybe that's so much work to do that you won't be able to do that. There are companies out there, these are not the only companies, there are companies out there who would be able to give you assistance. So last month, the Caregiver Foundation actually had a session with Navient, and they worked basically on caregiver burnout. But there's other things. I know they're going to be coming back to Navient and giving a little other presentations. But if you look them up, if you can look them up on the website, they do a lot of other things. And maybe they could help you with trying to figure out what you really need. Or maybe you as a caregiver need training, they can do that. Ho'okele Health, they have navigators. So what are navigators? Navigators help you through the process of, as they say, the healthcare puzzle. It's very confusing. And that's why I know people have come on board to this presentation, because it's really hard to understand the difference between home care and home health, right? But the navigators might even be able to help you say you need help to go to the doctors and need someone to help explain to you what the doctor actually said, because sometimes it gets confusing. So that's what the navigator can do. But if you call them, they can tell you more about what they do. Options for elders are kind of like case managers, and they can also help you to find the best place for the patient to be. Whether it is to live at home, they also might be able to help you get caregivers in the home, like the home care side. Or if you need to be somewhere else, in assisted living, a care home, or a foster home. So we just want, of course, all of us just want people to be safe. If they can stay in the home, that'd be the best place for them probably. So, but we need for them to be safe. And last of all, kind of last, I have down licensed home care agents. You can find them at this site. So you can go back to this presentation, go all the way towards the end, so you can see what site you can go to find where the home care agents are listed. If you choose a home care agency, I want to be sure that you choose someone who is licensed by the state, because that licensed home care agency has certain criteria they have to follow according to the state. And they have to, they get surveyed about every 2 years. So the agents, the state will actually follow up to do a survey on them. So that's why I want the home care agency to be a licensed home care agency. And that's my email. You can look it up later too. As you see here, I forgot to tell you that it does say csuzuka@queens.org. And that's because CareResource Hawaii is a joint venture of the Queens Health System and the Kuakini Health System. So we're so much percent owned by Queens, so many percent owned by Kuakini. But that's why it says Queens. We are fairly independent, a little bit separate from the hospital. And just to let you know, if you go into Queens Hospital because you're sick and you come out, they won't force you to have me. You can have anybody you want. You can have any home health agency that you need, any home care agency that you need. That is a requirement from the hospital that they have to give you options. So you do not have to have my company. You can have any company that you want. And let's go over a little bit about the differences. So on the difference, these are questions we had earlier. So the home health needs a physician orders and most insurances cover it. And home care is either private pay or Quest or long-term care insurance. For home health, you need to have a physician if you need a nurse or therapist. We basically educate the patient and family in home health, and we help the patient to improve their health. So hopefully by the end, you'll be a lot better, a little better than when we first started. And it takes about 30 to 60 days that the person is in for home health. For home care, it could go on for years if you need it to be. And usually no orders are needed because you need a home health aide or a chore person. Like I said, please check the Department of Health website for a licensed agency and try to call at least 3 agencies. Otherwise, we're calling one, didn't like the answer, they couldn't find someone, call another. So that's just helpful for you when you're when you're trying to get someone to help you. And last but not least, do you have any questions?
Thanks, Corinne. That was a lot of great information. And just a reminder, please type your questions into the Q&A box. We did have a few questions about if the slide deck will be available. So we can email it out to the group after this presentation is over, so you can reference Corinne's email as well as the links that she provided on there. So I guess, is your elderly parent, if your elderly parent is living with you, not alone, can they still qualify for Medicare certified home health?
Absolutely, absolutely. Yes, they can. It really is just a doctor will order it. And so, yeah, whether there are lots of people in there who possibly could help, you're all busy too. And maybe we need to do some training for both the family or for the patient to get them stronger or to make them, help them to get healthier. So yeah, absolutely. Medicare certified home health can help. Just call your doctor.
And somebody wants to know if you take phone calls, and if so, could you provide a phone number that they can contact?
Oh, okay, sure. Let's see. My number here is 691-4663. Let me just double check because when you ask me on the moment, I don't know why I forget.
I can also type it in on this question too.
Yeah, so it's 691-4663. I have another number too, because we have both home health and home care. So my other number is 599-4999. So I can help answer questions that you may have. If you would like to if you have a referral, then if you could call and talk to my people who take care of that, because it would be a lot faster. But if you have questions, you can definitely call me.
Okay, any other questions before we wrap it up? Okay, here's another one. What is the benefit of getting a geriatric doctor versus personal doctor?
It just depends, I guess. It depends who your personal doctor is. So you may have a say a family medicine doctor, they might still be able to help you. But if you have special needs, that sometimes the medications for someone who's 36 versus the same medication for someone who's 73, it could have different side effects. So, that could be a difference why you might want to. You usually have to have a referral from your regular doctor to go to a geriatrician. But sometimes, I guess, and the Queens, I'm about plug for Queens. Queens does have a geriatric area.